everyone, and welcome back to the Living Well with Schizophrenia YouTube channel. In today's episode, we are continuing with our series of interviewing healthcare professionals, and today we are going to be interviewing a clinical psychologist by the name of Dr. Aubrey Moe. She is a clinical psychologist and on the faculty at Ohio State University, and she also is part of the clinical treatment team at the Ohio State University Early Psychosis Intervention Center, or EPIC as she refers to it often in the interview. I'm really looking forward to seeing the insights that Aubrey has, particularly around early intervention treatment as a form of treatment for schizophrenia or schizoaffective disorder. And that's kind of what we're going to be focusing on in this interview, is kind of what early intervention looks like and what a psychologist's role is in that, and what new developments are in terms of early psychosis intervention. Also, just a quick note that if you would like to help support the creation of future videos like this one, please make sure to check out our Patreon page. The link is in the description below. We're working really hard to keep creating new resources for you that hopefully are really valuable. And so if you would like to help support the creation of these resources, please check out our Patreon page. Thank you. Hi, everyone. So today I'm here with a psychologist named Dr. Aubrey Moe. Hi, Aubrey.
Hi.
Thank you so much for joining us. We're going to be talking today a little bit more about what early intervention for psychosis looks like and why it's important and what it can look like in terms of helping people who are living with schizophrenia or schizoaffective disorder. So I guess to start off, can you just tell us what is early intervention?
Sure, absolutely. First, thank you so much for having me. I'm really excited to be here. Early intervention, broadly defined, is really an approach to care that involves giving an individual specialized services as soon as possible following the initial onset of symptoms. And so in the US, this is usually called coordinated specialty care. And in other places like Canada and Australia, it's called specialized care for first episode psychosis. And every program looks a little bit different, but in general, treatment involves a team of providers coming together from different disciplines to form a treatment team for each individual. And again, although every team is a little bit different, this usually will include a psychiatrist, a psychologist, other clinical staff or social workers that all come together to support the individual.
Right. Yeah. And so I guess, why is early intervention important?
That's a really great question. So we actually know that early intervention is really important. So there is a really nice accumulating body of literature suggesting that there is what we call a critical period during the first few years after somebody first develops psychosis. And it's a critical period because we know that during these first few years is really when the majority of the decline in a person's health or the decline in a person's functioning is most likely to occur. And we know at the same time that during these first few years is actually when people with psychosis will have the largest treatment response to any sort of pharmacological treatment, so medication or other psychosocial interventions as well, like therapy. Mm-hmm. So really what that means is that if you can give people specialized services early on, those treatments will be usually more beneficial during the early phase than if those same treatments were given later on in the development of the illness. And because we know that this first initial critical period is so important, one of the major goals of early intervention programs is to reduce what we call the duration of untreated psychosis, or the DUP. And the DUP really describes the period of time between when somebody first becomes ill up until the time they get connected with special services for the psychosis. And although everybody is a little bit different in how long that it takes, we know that many people, unfortunately, have quite a long DUP. So in the United States, there are data suggesting that the DUP for many people will be somewhere between 15 to 18 months. So up to a year and a half. And so if you want to put this into context, you can imagine, that maybe you had an accident and you broke your leg. And then you had to wait a year and a half to get treatment for your broken leg. Mm-hmm. That's a long time. Yeah. And it wouldn't be hard to believe with that example, that not only would that person had to have dealt with probably quite a bit of pain for a prolonged period of time, secondary to having that broken leg, but that they probably have other problems now related to not having any treatment for so long. Maybe it's hard for them to work. Maybe it's hard for them to stay engaged with their goals. or really just to move around and do things to take care of themselves. And we kind of think that what happens for people with untreated psychosis is similar, that not only do individuals have to deal with symptoms that can be, confusing and scary for a really long time, but that there are other things that have probably been difficult for them by virtue of dealing with those things, becoming disconnected from friends or family, having a hard time working towards school goals or work goals. And so we know that, of course, early intervention matters because we want to help people to understand and manage their symptoms, but we also want to help them to kind of change that trajectory, to be able to prevent some of the other things that can become really difficult when they're dealing with those things.
Right. Okay. So yeah, like offering services as early as possible to kind of negate some of the additional effects of dealing with an illness like schizophrenia or schizoaffective.
Absolutely. Yeah.
So we talked with the psychiatrist in our last interview like this, and she mentioned the prodromal phase. And so is it possible for early intervention to take place during this phase, or is it just kind of after your first episode of psychosis?
That is such a great question because more historically, treatment has been thought to be most effective when somebody's already sick. So when they develop psychosis, and we know that that works, but naturally it lends itself to the question, well, what if we can catch it even sooner?
Right.
So understanding what the prodrome is and how to capture it is actually a really big area of developing research in early intervention. And so recently there's been increased focus on what we call clinical high risk for psychosis, or we call it CHRP here in our clinic, which is trying to identify different markers that people oftentimes show before they become ill, but that tell us they're at elevated risk for developing a psychotic disorder. Because as you mentioned, there's the prodrome, and we know that there are different more subtle changes that can happen in terms of people's emotional experience or behavior or perceptual experiences even. And if we can catch them early, perhaps there's a way that we can prevent conversion to a psychotic disorder, or get somebody connected with services early so that if something does happen and they do develop psychosis, they can immediately be linked with care. So this is actually something that we do here at EPICENTER in terms of having a separate but related kind of sister clinical program so that we can help to identify these people early on and to help them with interventions that are geared toward where they're at and their needs.
Right. Okay. So what does early intervention treatment typically look like?
Yeah. So early intervention treatment typically will involve a treatment team. As I mentioned, typically, people will have access to a psychiatrist, a therapist, and other clinical staff members. And every program is a little bit different. But in general, the idea is that an individual will work with their treatment team to really design their own plan of care. And so the way that we organize things here at EPICENTER, we have people select from what's called a menu of treatment options. And so we will offer different treatments, including medication management, different forms of individual therapy, family education and support, and other group opportunities. And then it's up to each individual to decide what it is that they want to do. And we think that's really important because we utilize what's called a shared decision-making model, which is really common in early intervention programs, where really we want the individual with psychosis to be a crucial and really involved member of their treatment team, because we know that treatment works best when people are working on what they want to work on and where their treatment is best aligned with their treatment goals. And so that being said, while everybody has access to the same services, what somebody's treatment is going to look like will vary quite a bit from person to person. Mm-hmm. So for example, we have people who receive services here who maybe only want to work with a therapist. So maybe they'll come in once a week to work with their therapist, and that's all they want to do. I would say more typically, we have people who will utilize multiple services. So maybe they see their therapist once a week, twice a week, depending on what's going on. And then they come in to see their psychiatrist every few weeks as well. We have other people who decide that they want to try everything, and that's okay too. So they may be here multiple times a week based on what it is that they want and where they're at in their treatment. So things can look different from person to person, but they can also look different over time. There's a lot of flexibility in allowing people to change their treatment as they go based on feeling that maybe a need has been addressed, or if a new need develops, they're able to change their treatment plan to include that as well.
Right. I really like that concept of kind of empowering the person living with the illness to kind of decide which treatment fits right for them and to kind of work with you guys to figure out what the best plan is for them. Is your clinic's approach kind of the norm in terms of early intervention treatment, or is it different, or what is the typical?
Yeah, I would say when it comes to how we provide early intervention services here, there are probably more similarities than differences. Using a shared decision-making model, using a team-based approach to treatment are all really kind of foundational parts. And so pretty much everyone will approach treatment that way. There are some things that we do a little bit differently, and one of those things has to do with how particularly broad we are in providing care. So one of the things that we're, really intentional about at EPICENTER is providing the best evidence-based care to as many people who can benefit. And as part of that mission, we provide services to anybody from age 15 to 35 who has developed any symptoms of psychosis related to any specific diagnosis in the past 5 years. And this is a little bit different. So there are some early intervention programs that focus more specifically on, a diagnostic group. So one common thing is that many programs will focus on providing these services to people who have experienced the onset of schizophrenia. And while we certainly provide services to people who have experienced the onset of schizophrenia, it's not the only kind of diagnosis that we treat. So because we're more symptom focused on psychosis, we'll also treat people who have bipolar disorder with psychotic features, who have major depression with psychosis, or schizoaffective disorder. And so that does make us a little bit different, but we do that because we believe that if we focus on psychosis and our treatments are appropriate for those symptoms, then it's a good treatment strategy and approach to making this available to as many people as possible. Right. The fact that we provide services for up to 5 years following onset of symptoms is also a little bit different. Many programs will provide services for up to 2 years following onset of symptoms. But as I mentioned before, if the duration of untreated psychosis for many people is 1.5 years already, it's not uncommon for people to have already had multiple years of illness before they even have the opportunity to connect with services. So by extending that window a little bit, we know that these treatments can still be useful to people who are a little bit farther in that initial onset of their psychotic disorder.
Yeah, we've been talking on the channel kind of about the idea of a spectrum of psychosis in terms of symptoms that come about being kind of related in terms of bipolar with psychotic features and schizophrenia and schizoaffective disorder. So that's really interesting that you guys are kind of adapting that model of thinking in terms of looking at it more as what symptoms are being presented as opposed to what is their diagnosis.
Yeah.
So that's really great. And then also hearing that you treat for longer periods of time is also really encouraging, because that's another kind of critique that some people have of early intervention, is that it's just kind of leaving out this huge number of people who haven't had access to proper services as quickly as we would like. So that's really encouraging to hear that you treat for longer periods of time too. I guess next question is, what are kind of some emerging research data or treatment options for early intervention?
Yeah, I like this question because I think in a lot of ways we're living in kind of an exciting time when it comes to advancing our understanding of psychosis and our understanding of how to provide the best care. And this is all kind of based on a big research initiative that happened in the US a few years back from the National Institutes of Health called the RAISE trial. And so these were studies looking at the specific benefit of early intervention for people compared to kind of standard community care and how that would help them in terms of their outcomes in the first few years of illness. And we now know it's really helpful. Early intervention really works well to help people, change not only their symptoms to have reduced psychiatric symptoms, but also improve quality of life and improved involvement in things like work and school. Really important goals. Mm-hmm. And based on these really seminal data, there's been a lot more work on figuring out how to make those treatment packages even better and more widely available. And one of the things that I think is really exciting is that people are recognizing that there's a need for us as clinicians and as clinical programs to more comprehensively address the needs of people with psychosis. Because we know although most people who experience the onset of a psychotic disorder do want to understand their psychotic symptoms and do want to manage them as part of their care, that's usually not their only goal, almost never, really. So we need to do a better job of being able to try to integrate additional treatments that help other aspects of people's lives that really get impacted by illness a lot of the times. And one of the exciting things with that are cognitive enhancing interventions. And so we know that most people who experience the onset of a psychotic disorder will also have changes in their cognition or their thinking skills. Things like changes in their concentration and attention, maybe more difficulties remembering things, or problems with organizing their thoughts or behavior. And we know that these things tend to stay pretty stable, even when somebody's positive symptoms are well managed, and that these cognitive difficulties are really, really related to important functional outcomes. So somebody being able to go to school or go back to school, to work in their desired field, or even to have interpersonal relationships, really important things that are impacted by cognitive problems. And because medications don't really help with these things, we need to do more. And so there are these specialized interventions coming out to address this in a more targeted fashion. And so at EPICENTER, we actually have a specialized intervention to enhance cognitive functioning that is an individual therapy that we call metacognitive remediation. And the focus of this intervention is actually working through a series of computerized games in an individual way, so one-on-one with the therapist, where the individual uses the games as an opportunity to really improve their awareness of their own thinking skills, how they approach problems, strategies that they may want to use, how they deal with things when they don't go well, how they evaluate the strategies that they actually utilized, things that can be really, really important, not only for the games, but really in somebody's life outside of the clinic. So there's a good deal of discussion in this intervention about how to take what the person worked on with the therapist on the computer games to something that probably matters much more to them, with handling difficulties at work, difficulties at school, or with planning. And we know that people who complete this intervention show not only improvements in their cognitive functioning after 6 months, but really importantly, improved engagement with work and school, which is a really major goal that people have. So we know that if we make this intervention available and people who are having cognitive difficulties engage in the treatment, we can help them to really alleviate some of that difficulty and get them back where they wanted to be.
Right. Cool. That's really encouraging, because I know that's something that I struggle with, is like the cognitive symptoms and the negative symptoms, which are usually often overlooked in terms of treatment. It's usually just focused on how can we get rid of your positive symptoms and then just kind of forget about the rest and not really address the cognitive symptoms and the negative symptoms. So, which are really like the debilitating ones in terms of quality of life and that kind of thing. So that's really great to hear that there are new interventions coming out that is addressing those concerns.
Yeah.
So that's really exciting. So thank you so much, Aubrey, for joining us today. Your insights and information that you provided were really, really valuable. And I think a lot of people are going to find them really helpful. So thank you so much for taking the time to interview with us today.
Absolutely. Thank you for having me.
Yeah. Okay. So take care, and hopefully we'll talk to you again soon.
Sounds good.
Okay. So a huge, huge thank you to Dr. Aubrey Moe for being a part of that interview with us. Early intervention in psychosis is kind of like a buzz topic right now, and so I know I learned a lot more about what it actually entails through this interview with Dr. Aubrey Moe. So big, big thank you again to Aubrey for being in that interview. So if you enjoyed this video, please make sure to like it, and also don't forget to subscribe so as not to miss any future videos we put out in this series. We're planning to interview plenty more mental health care professionals, as well as just different people, to gain different perspectives about what it's like living with schizophrenia or treating schizophrenia. And so make sure to subscribe not to miss any of those. And also just one quick final reminder that if you would like to help support the creation of videos like this, please make sure to check out our Patreon page. The link is in the description below. Thank you so much again for watching, and as always, wishing you and your loved ones good health. See you in the next video. Bye.